Hi everyone, this is Dr. Preston Witherspoon at Fix the Cause Chiropractic, right here in Duncanville, Texas. And I'd like to talk with you just for a few minutes about some stuff that's really important to me. First things first, to clear up some confusion, it's become apparent to me from some patients that a lot of people are not aware that we are actually still open. What happened was the judge here in Dallas said one night he said we had to close, and then 24 hours later, right at the end of the day, he said, well, we could stay open, but we could only see people who had acute conditions. So we are seeing people in the office if you're having flare-ups, if you're having any kind of symptoms, or if you're on an active care plan for conditions we've already talked about. So we are available. Just know that if you've been a patient or if you're a new patient watching this and you've got something going on, we are allowed to take care of you at this time. But the reason I wanted to make this video was because I want to be able to support everybody's health during this time. We're not allowed to see all of our maintenance patients to make sure their health is staying up, but one way that I can reach out and touch everybody is through nutrition. I love nutrition, and through the years I've used two different tests, one called SpectraCell, one called ALCAT, and I've used those to help address the patient's needs, especially those that have a specific interest in those tests. But two things have happened recently that have made me both refocus on nutrition and also to decide how to change what I'm doing with nutrition in the office and who we use for testing. First, I was talking with a colleague about the ability of my patients to heal, and he asked me what I was doing to make sure my patients' bodies had the right building blocks to build their bodies up as they heal with chiropractic care. And after a short, awkward silence, I had to admit that I'd only been offering that advice after they'd completed active chiropractic care. And his question to me was, how can you expect someone whose body does not have the right nutrients in it to heal as completely as they can? So I took that as a challenge. And for that reason, I began talking to as many of my patients as I can about basic nutritional needs as part of the healing process. The second thing that happened was that both of those testing companies we've used over time, SpectraCell and ALCAT, they've become, in my opinion, unreliable. I've had several patients over the last 6 months have to wait weeks or months for their test results to arrive. It used to take 2 weeks maximum, and to me that's unacceptable. So in the coming months we will be switching our testing to a system called Well Aligned, and we'll be able to perform those tests in our office. I actually know the doctor who's designed that system, and he's collaborated with doctors and labs across the world to make sure that the results are solid and that any kind of nutritional recommendations coming out of those tests are based on current research, not the decades-old RDA and that you find most supplements using. When it comes to the coronavirus, nutrition is a key way you can support your body at this time. There's a tremendous need to make sure each one of us has the best functioning immune system we can have. One of the primary nutrients in establishing a well-functioning immune system is something that most of my patients are already doing, and that's taking vitamin D. Part of the reason vitamin D is an immune booster is because it triggers the appropriate release of cells called cytokines. I'm going to get to cytokines later, called leukocytes. Those are primary defenders in any kind of infection. So if you've been taking our recommended dose of 4,000 to 6,000 IUs of vitamin D every day, your blood levels of vitamin D are most likely in the protective range already. If not, we do stock a well-absorbed vitamin D at the office right now, and we do have a few left. Regulating chronic inflammation is also vital in making sure your body can handle infections. I'm a big Cowboys fan, so please pardon this analogy. If the quarterback's being rushed by 3 defenders, and there's 5 defenders and only 3 blockers, the quarterback will be overwhelmed and the play will fail. In the immune system, if it's being overwhelmed by chronic inflammation, when attacked by something like a virus or a bacteria, a body's immune system can be overwhelmed if it's too busy dealing with chronic inflammatory conditions. One of the primary ways to reduce chronic inflammation in the body is with a well-formulated and pure omega-3 oil. Omega-3s regulate inflammation, and if your body is assaulted by a virus or bacteria, but is not chronically inflamed, It increases the likelihood that your body will be able to respond appropriately. Finally, when the body's fighting inflammation, along with viruses and bacteria, it can create free radicals. And eliminating free radicals requires antioxidants. Glutathione is a critical antioxidant for the body, and it can also help heal some issues in the gut lining as well. So all three of those nutritional interventions are critical to ongoing health, especially in the face of the coronavirus issue that we're dealing with right now. We only stock vitamin D here in the office, and that tends to sell out quickly. If you want to order the others, we can direct you where to go online to order them, and they'll be sent directly to your door. Finally, as I wrap up, I'd like to ask everyone watching, especially my patients, but even if you're not, to do something for me. I'd like everyone to go to our website at fixthecause.com. Just like the name of our clinic, fixthecause.com. Let me pause for a second here. And those of you who are able to do this on the screen at the same time, go ahead and go there. Well, at the top of that page, you will see wellness and nutrition. And I'm going to flip the camera here so you can see what I see here on our webpage. So let me do that for you here. Okay, in my forays into all this selfie stuff, I can't flip the screen on my phone right now. But I'm going to turn the phone so you can see what I'm seeing here on the screen. So right here, you can see our webpage, and you can see right at the top there, it says, fill out your environmental risk evaluation here. Now the way you get there is by coming to Wellness and Nutrition, come down to Nutrition and click there, and it will bring you to this page. So right here, you see this link, fill out your environmental risk evaluation here. If you're interested in finding them out, the amount of stress in your system, the amount of stress your body's dealing with based off of nutrition and your general habits and your environment, take about 5 to 10 minutes and fill out that assessment. It will send me a copy of your results when you finish it, and if you want me to, I can take the time over chat or over a video conference to talk with you about ways to address any issues that show up in that. And because I want to take care of everybody, I'm going to offer that to people who aren't even patients. So if you have family members or friends who want to take advantage of this as well, please send them that link as well, or direct them to our website in the nutrition tab. So that's all from me today. Thank you for watching and listening. I look forward to seeing your evaluation in my email, and I look forward to seeing all of you in the office after the shelter-in-place ends. God bless you all.